Unexplained injuries, a lack of personal care and hygiene, and severe dehydration. A local woman says her family's been fighting for years to find out what happened to their mom inside a Massachusetts nursing home.
25 investigators learned the state has not fully inspected that particular nursing home since 2018. An anchor and investigative reporter, Carrie Cavanaugh, found the state hasn't conducted regular inspections of dozens of nursing homes since before the pandemic.
This isn't acceptable for a child. So why is it acceptable for the elderly?
That's one of many questions Crystal Johnson has about her mother's care at Sterling Village Nursing Home in Central Mass. In March 2020, her mom, Donna, entered Sterling Village after suffering a stroke while battling Alzheimer's. At the time, the state was under severe COVID-19 restrictions.
And we couldn't get into that building at all.
The family's only visits were through windows or outdoors.
We just thought everything was perfect. They just told us what we wanted to hear.
By January 2021, Donna's health was failing. She was admitted to a hospital for testing, and Crystal says that's when her family got a call from a hospital doctor.
And what did the doctor tell you?
That she came in with some severe injuries, cracked ribs, internal bleeding. She was severely dehydrated, black ulcer on her back, toenails this long.
Sterling Village has not responded to our request for comments. Family says they filed this complaint with DPH questioning the mother's injuries. They said DPH investigated and found no deficiencies. And the Centers for Medicare and Medicaid Services lists them as having a 4 out of 5-star rating. But 25 Investigates has learned Sterling Village hasn't had a recertification survey since 2018. According to the Massachusetts Department of Public Health, they inspect nursing homes at least every 9 to 15 months to assess compliance with federal standards of care, like staffing, quality of care, and cleanliness of facilities. We wanted to know how many other nursing homes in our state had lagging surveys. An analysis of data from a special U.S. Senate committee report reveals 32 other nursing homes in Massachusetts haven't had one of these surveys since 2019.
What role does DPH play here, and have they been failing Massachusetts families?
A great failure for a long time, and they're failing them until it's fixed.
State Senator Mark Montigny, chairman of the Joint Committee on Health Care, says despite the spotlight created during the pandemic, Massachusetts nursing homes are in crisis.
There are absolutely good nursing homes, but why are we allowing the bad? Why are we allowing the mediocre? It's hard to lose your license.
Identifying trouble spots falls on the shoulders of DPH's 82 surveyors that have to inspect 41,000 nursing home beds. That's a rate of 504 beds per surveyor. According to a new report by the U.S. Senate Special Committee on Aging, Massachusetts surveyors have the 14th highest caseloads in the country. We asked DPH about the lagging inspections and high caseload rate. DPH noted the feds halted all inspections during the COVID-19 pandemic, which created a backlog. But the state says since resuming inspections, they've reduced that backlog by 84%.
So in some ways, I think it's worse than ever.
Which is one of the reasons Montigny has filed legislation to increase the state fines up to $23,000 per day, matching federal standards.
The current state fines in Massachusetts, do they have any teeth?
Nowhere near enough. First of all, the state fine is a joke. I'm embarrassed to tell you it's $50 a day.
Sterling Village has faced $95,000 in penalties over the past decade, but by comparison, a recent survey found the average annual cost for nursing home care in Massachusetts last year exceeded $151,000 a year.
How do these things happen? Why is there no documentation?
Donna Johnson was 72 when she died in 2021. The family doesn't claim Sterling Village caused her death, but continues to question how much she may have suffered in her final months.
Why are you sharing this story now, 2 years later?
I feel like it's not talked about enough, what happens to our loved ones in these places. This could be your mom, your grandmother, your aunt, your sister. And is that the care we want?
That special Senate committee report we referenced in the story found inspection delays combined with staffing shortages are endangering nursing home residents. We have a link to that report on Boston25news.com. There you can also find the federal database to see details on the inspections of your loved one's long-term care facility. For 25 Investigates, I'm Carrie Cavanaugh.